Hi, I am Mikel Prieto. I'm the Surgical Director of the Kidney and Pancreas Transplant Program here at Mayo Clinic in Rochester, Minnesota. I want to talk a little bit about the situation where somebody needs a kidney transplant and has a donor, but the donor is incompatible. Some transplant centers are have a very narrow definition of who can be a donor. Sometimes a donor gets disqualified because their weight is above a certain limit, or because they are above a certain age, or because they have a little bit of hypertension. Sometimes donors disqualified because they are of a different blood group than the recipient, or because the recipient has some HLA antibodies against the donor, so they have a positive cross-match. All those problems sometimes have solutions, and sometimes what it means is that you need to find a transplant center maybe has a different approach to living donation. We do a lot of living donors, and we have been doing this for a long time, so we have a long tradition of this. And we offer many different alternatives to these patients who have a donor that may not be ideal. For example, one of the typical ones would be to include the patients on a pair donation program. If you have a donor that has some degree of incompatibility, things like tissue typing incompatibility, or blood group incompatibility, or there's a big age discrepancy, or there's other factors, we can find through pair donations sometimes another donor will be suitable for you, as long as your donor is willing to donate to somebody else simultaneously. Now, sometimes the donors have been disqualified because they have mild hypertension. This is not always a disqualification for us, because as people get older, hypertension, especially when it's mild and well controlled, is very common. And we don't feel that if, let's say, a 60-year-old that has some mild hypertension should necessarily be disqualified from being a donor. So if you are looking to get a kidney transplant and you have been told, sorry, we cannot do this because your donor has mild hypertension, you should consider looking at other programs, like our program, to see if that donor could actually qualify to receive a transplant. Other factors as well. BMI is another one. Some centers are very strict. We feel that from the surgical point of view, even when the donor is overweight to a certain degree, and we have some limits, of course, they can safely donate. And we have done many donors like this. The most important thing is that the donor has a safe procedure at a center where we are used to doing a lot of these kind of procedures with good track record. And obviously that we try to provide the best options for a living donor kidney transplant for each recipient. The large transplant centers like ours, especially when we are working in a pair donor program in collaboration with other centers, are really the best option for these patients.